Australia has an ageing population. The proportion of people aged 65 years and over has steadily increased over the last century, and this trend is expected to continue. By 2022, it's estimated that there will be 4 million people aged between 65 and 84 years of age in Australia. This has significant implications for our community and our healthcare system. From a health perspective, we see a greater prevalence and incidence of chronic conditions in the older population, particularly with ageing-associated diseases like cardiovascular disease, cancer, arthritis, dementia and more. Coupled with longer life expectancies, this means there are more people living with disability and frailty. Here at the University of Adelaide, our researchers are working collaboratively to explore the nature and impact of frailty and ageing.
We're all getting older, and so we're interested in maximising health and longevity. We've known for a long time that calorie restriction can extend lifespan, and it's actually emerging that intermittent fasting can do the same thing and increase lifespan. And so we're interested in understanding whether intermittent fasting will extend biomarkers of ageing.
In geriatric medicine, we are very much interested in improving the care of older people, especially those who are frail or at risk of frailty. Our research center is very much focused on transdisciplinary research. So one of the things we did quite early on was to work with engineers from the University of Adelaide to design the system to help prevent falls in hospital.
A lot of people who are elderly have low back pain, and one of the tasks that they have difficulty with in everyday life is bending down and lifting objects from close to the floor. We've been investigating a new technique for achieving this task. We measure their motion while they're undertaking a number of different traditional lifting tasks and the brace lifting task. We hope that ultimately this research will lead to patients being provided advice by their physios and clinicians to undertake such tasks using the brace lifting technique, and this will enable them to continue carrying out activities of daily living in their home pain-free.
The impact of palliative care in ageing is really important. It's important we build in research questions that consider the potential for death as well as the ageing process. If we can understand some of the problems, then we can do something to make it better. People who are potentially going to die still value their living, and we want to make sure that they're getting the best quality of life, that they're getting the best choices, that we're doing the best to improve their symptoms so that health systems, doctors, nurses don't get in the way of them living until they die.
So over the last 20 years, we've seen a significant increase in the number of Aboriginal and Torres Strait Islander people who are living long enough to require aged care. We expect over the next 10 to 20 years, the number of Aboriginal people over the age of 65 will increase significantly. Our work at the University of Adelaide is fundamentally focused on how we overcome chronic conditions in Aboriginal and Torres Strait Islander people, how we build better healthcare systems to respond to their needs, and how we reduce the inequality that exists between Aboriginal people and the remainder of Australian society so that all Australians can enjoy a healthy, prosperous life.
Our research into ageing and frailty is broad and its potential impact far-reaching. Experts in geriatric medicine, general practice, nursing, pharmacy, orthopaedics and rehabilitation medicine are joining forces with researchers in knowledge translation, health economics and epidemiology. Using a cross-disciplinary approach, our aim is to make a difference, not just to the longevity of people's lives, but to their quality of life. The benefits of our research are clear, for both the individuals affected and our entire community.